Hi everyone, I'm Liz Holmes-Truscott, Deputy Director of the Australian Centre for Behavioural Research in Diabetes, and I'm focusing today on the issue of weight stigma. So we've heard what evidence-based and system-level obesity prevention and management action is so desperately needed in this country. But in taking any action, we must also ensure we're not only addressing the harmful issue of weight stigma, but not contributing to this problem. It has already been said that weight stigma is a major barrier to equitable healthcare access and support for people living with obesity. Indeed, there is a wealth of scientific evidence and lived experience reports showing the harmful impacts of weight stigma, including those reported in this very rapid talk session. At an individual level, we see that weight stigma is associated with considerable mental health consequences, including increased depression and anxiety symptomology. It can lead to avoidance of healthcare, delayed presentation and screening, as well as lower quality of care provided. Weight stigma is also associated with worse physical outcomes, and it can actually perpetuate the problem of obesity, as it is associated with disordered eating, reduced exercise, and weight gain. So weight stigma can actually negatively affect people's ability to manage their weight. It can also exacerbate socioeconomic disadvantage through reduced educational, social, and employment opportunities. At a societal level, weight stigma can negatively impact public and political support and funding for the much needed action that we've spoken about today. Weight stigma arises in part from a lack of understanding around the many drivers of obesity, including the strong social, biological, historical, and environmental factors. It can also be driven by the overemphasis on personal responsibility, and it's reinforced by a simplified narrative whereby shape and size are incorrectly and harmfully assumed to equate to behaviour and effort. Weight stigma needs to be more widely addressed in both society as well as within the healthcare system. However, there is currently very little investment nationally on understanding, monitoring, and addressing the issue of weight stigma, bias, and discrimination. We need a range of actions to help bring an end to weight stigma and its harmful impacts. In the first place, we need to address weight stigma within clinical care through guideline implementation and training for health professionals. We know that stigma is a barrier to best practice early intervention and treatment for obesity, as well as related chronic conditions. Yet weight stigma is prevalent within the healthcare context and commonly perpetrated by health professionals, often without realising. This needs to change to improve people's care and outcomes. And health professionals are really well positioned to not only reduce their own stigmatizing practices, but support individuals who are presenting having experienced weight stigma in the broader context of the community. To take action, we need to include weight stigma as an official priority in developing implementation plans, materials, and communications for new clinical guidelines. This could include training and resources aimed at increasing non-stigmatizing practice, as well as enabling health professionals to recognise and support individuals who are suffering the harms of weight stigma. More broadly, we need to continue to acknowledge the occurrence of weight stigma and ground all prevention, management, and support guidance and implementation plans within this context. Best practice guidance that is framed in a way to consider and help address weight stigma will help reduce its harms and improve clinical care. Healthcare providers have an important role to play. They can powerfully perpetrate the issue or counter weight-related stigma in their interactions with clients. A better understanding among health professionals of the complex drivers of obesity, the lived experience and benefits of person-centered care, and non-stigmatizing practice will ultimately lead to better outcomes and care. Thank you very much.